X-Ray Associates is a privately owned radiology practice. We own 7 outpatient imaging centers throughout the state of New Mexico, as well as work with 4 different hospitals. So we have been using Sectra PACS since 2006. It has grown tremendously since we first started using it. Since then, we've received numerous upgrades. Every year we get a new upgrade, and it always comes with additional features and tools and bug fixes. The most recent and life-changing experience for our radiologists with the PACS has been the patient linking application. We went live with that about a year ago, and that was important because we, as I mentioned, we are connected to several hospital systems, and so a patient could be seen at 4 different facilities and have 4 different medical record numbers. Using the patient linking application, our radiologists are now able to bring up the patients with 1 medical record number and be able to see comparisons in chronological order as if they were all done at the same facility. So that has been tremendous for our RADs in being able to give more accurate diagnosis and do better comparisons. So patient linking works through an HL7 interface that we use our CorePoint engine for. ORMs and ADT information comes through the interface, and then we do a match off of 5 demographic elements. That seemed to be the sweet spot for us in order to merge appropriately, but not over-merge. We had some difficulties with managing, children who who have the same exact name, date of birth, address as a parent. So the sweet spot was 5 demographic elements out of 21 possibilities. And then the interface sends a message to our Metinformatics RIS, which then communicates the information to our Sectra PACS, which then does the patient linking application. So when the radiologist is bringing up a current case to read, if the PACS sees it as a same patient, it's going to bring up the patient history and images, hanging protocols, everything as if it were all done in the same location with the same medical record number. We were one of the first in the world to actually read on a dedicated PACS instead of on the Hologic secure view systems. That was important for our radiologists. Years ago, prior to Sectra, we had reading rooms that looked like IS suites. There was a workstation for PET, there was a workstation for mammo, a workstation for, reading general X-ray. It was a mess, and different keyboards, different, mice and KVM switches in order to make things, smoother and more efficient for our radiologists. Since we've been on PACS, the drive has been to put everything within the same PACS system. So when Tomo technology came out, and of course Hologic came out with the Hologic Secure View, and this is how we were going to have to read Tomo, our docs were, no, absolutely not. We've done all this work to put everything in Sectra PACS. We wanted to keep Tomo in Sectra PACS as well. So we worked with Hologic and Sectra in order for them to work together in order to get the Tomo built into the product. And so from day one, when we brought up images, Tomo images, we were reading on Sectra PACS. With time, Sectra is taking the best of the tools that are coming to us with the plugins and building it within the product. So like, for example, right now, we use a MimVista plugin for our PET interpretations, which is nice because the doc's right there on the same terminal, is able, they don't have to search for the patient again. They're able to launch the application directly from the PACS application, and then we're able to, any screenshots that they've done get sent directly back into the PACS without having to, push them there. They're embedded in the system. When we're talking about the stability of the PACS, it's required. There is no room for downtime. There is no room for that. We have spent a lot of time with Sectra since 2007 improving the redundancies. Our PACS, knock on wood, does not go down. And if there is an issue, then, let's say it's a line got cut along the way, the system's technology has the capability of routing within nanoseconds so that the system does not go down. Our doctors don't feel it, even though they are going to a different server, they may not know it. When we first went live with Tomo, we were one of the first, and at the time, it wasn't even reimbursed by payers, but our physicians were driving that the need for a one-stop shop application. They didn't want to use different computer systems to read this new technology that's coming out. In addition, for being the administrator, I'm always looking at cost, and so with the sector bringing in these third-party applications, let's say, and embedded into their product, it's going to, in the long run, reduce what we pay for service contracts with these third-party applications. So having one computer system one workstation to upgrade versus multiple workstations to upgrade for the radiologists, that saves on costs as well. If I was looking for a new PACS today, one of the reasons I would choose Sectra is it's the full gamut of the tools that it can offer. We've gotten to a phase now with Sectra today that they monitor our systems remotely. They tell me about a problem before our IT even knows about it. They're paging our IT at 2 o'clock in the morning saying, you've got a lung out, be aware of this, so that we can solve problems before a doctor even walks in the door and uses the product. I feel like they're a great partner, for X-Ray Associates today.